You guys anticipate that right away there will be enough interest to do 6,000 per day, and and will it be like a phased approach? Like, will you start small and try to build up to 6,000?
So there's no doubt in our minds that we easily have the interest in our phase 1A group of 250,000 to easily vaccinate 6,000 a day. We're particularly concerned about having that vaccine volume out of the gate, so we're continuing to look at a pilot and phased process such that as we get more vaccine allocated to us from the Commonwealth, we'll be able to vaccinate that many people per day.
How do you feel being a part of this? I know inside there was mention of a lot of time, energy, and effort. What has it been like for you personally, and what's kind of the motivating factor? What's keeping you on top of this?
Sure. Personally, I'm a family physician. I practice in Quarryville, Pennsylvania. My family lives here, I work here, and of all the things I can think about as being a family doc, it means very much to me that we get as many people as we can vaccinated. So I'm personally tied to it and want to see us succeed as a community and as a county.
How many hours per day do you think you're dedicating to this cause specifically?
Yeah, I've lost track on the number of hours per day, but I did calibrate with my boss, our CEO, to make sure she's okay with supporting the effort, and she is.
Let me ask, there's still that if you build it, they will come mentality. That's still the belief here, even though we referenced it today about like 75,000 vaccines, and you go to, I'm sure if I could get you candidly, you'd probably say that health department, they're not giving us what we wanted. Is that the belief still? Like if you build it, they will give us the vaccine?
Yes, as we continue to talk with the Department of Health over the last several weeks, it's becoming increasingly clear to us that they also see that the health systems are very efficiently and effectively vaccinating their patients. They know how to find them, they know how to outreach to them, and those patients know where to get care. So as we see the Department of Health embracing that thought, I'm hoping they'll continue to embrace the community vaccination centers alongside those health systems, trying to vaccinate as quickly as we can.
So how much does it help? It's not just you, it would be not LGH, it would be WellSpan, it would be Lidditz, it would be UPMC, it would be Penn State, all working together as one.
Yes, all 4 major health systems in the county are working together as one to make this community vaccination center possible. We're all contributing in different ways. Penn Medicine Lancaster General Health will be the managing healthcare partner for the facility, but we're also supported with staff and leadership from all the other health systems.
I have to ask this question. The reason why we're here, and we don't usually come to a lot of commission meetings, I hope to get that one little nugget about that it's going to be at, where it's going to be at. Talk to me again so we get it on camera.
Sure.
About why we can't have that
Sure.
most important nugget, I guess, for some of us.
We are working very hard with the centrally located site that we've had planned for the community vaccination center. Our legal teams are closely working together to ensure that we have everything adequately documented, not only from a Department of Health standpoint, but also from a PEMA and FEMA standpoint, so that we can be ready to open up this site. So more to come on that contracting, and I'm hopefully within the next week or so, we'll be able to announce that.
Is this going to follow the model that's happened in Lehigh County at Dorney Park? Similar, in a way.
So, let's see how I start that. A few of us who are involved in the community vaccination steering committee are talking with several health systems, including Lehigh Valley and Atlantic Health in New Jersey. So we're combining our efforts and leveraging and learning from their lessons learned early on, so that we can incorporate that into our community vaccination center.
Do you anticipate that, because Lancaster is such a hub and you have, York County, Dauphin County, even Chester County nearby, do you anticipate people will drive in from those areas?
We are working together with the Board of Commissioners and the Department of Health to anticipate a potential larger scope for this particular project. Those discussions are ongoing, and we'll see, depending upon vaccine allocation, how we can support potentially a region beyond the county.
This is a huge undertaking. Why do you think it's important that Lancaster County has it?
I think as the 6th largest county in the Commonwealth, it's critically important for us to support and stand up a community vaccination center. At over 500,000 people, over 400,000 need to be vaccinated that are above 16. It's incredibly important for us to show our leadership in the Commonwealth as our ability to work together, both private and public partnership, to deliver this for our community.
You mentioned it would hopefully open in March. Do you anticipate how long it will stay open, or will it be until there's no longer a need?
We anticipate operating it for several months, and of course we'll continue to reevaluate that based on where we are in phase 1, phase 1B, and maybe even get into phase 2 into the late spring, early summer months.
How soon do you anticipate the Johnson & Johnson vaccine will be out to people?
Yes, it's really hard for me to predict right now where we will see the Johnson & Johnson vaccine. A lot of it will depend on the allocations we receive from the federal government and then those subsequent allocations from the Department of Health to us here in the county.
I guess, I'm sorry, I'm firing them away
No,
too.
it's
What do you think is besides the doses, what's the greatest challenge to getting this site up and running?
I would say the greatest next challenge we'll face after we seek approval from the Board of Commissioners will to effectively identify and train the staff. To me, the most important part and critical success factor for a site like this is having very engaged staff who understand what their training is, and we create a well-oiled, process-improved machine to effectively vaccinate our community.
Now, you mentioned in the last press conference, I believe 200 volunteers. Will the people actually administering the shots be volunteers, or will they be employees of the different health systems?
One of the things we're working on finalizing, and that's why the budget details are not released today, one of the reasons why it's not released today, is around the staffing. We believe that potentially having the necessary funding to support the payroll of all the staff at the Community Vaccination Center would be ideal. It creates consistency of schedule, it creates a consistency of roles, and it puts everyone on notice to really improve the efforts for the site.
My last question, and it's not related really to the site, but you know, a lot of other neighboring states have gone into phase 1B. How soon do you expect we will?
Yeah, it's really hard to anticipate right now, depending upon the level of interest in phase 1A to when we will get to phase 1B. With 200 to 250,000 people in phase 1A, we definitely need to be increasing our vaccination rates well above 2,000 a day to get to phase 1B soon.